Good afternoon and good night to all those of you who are joining us today from the different regions of the world. We would like to welcome you warmly, and we hope that the information that we provide you with today will be of use to prevent African swine fever. My name is Erika Calderon. I work for the Inter-American Institute for Agriculture and IICA, and this activity is being interpreted simultaneously in 4 languages: Spanish, English, French, and Portuguese. This event also has some expert guests that will be talking to us today about African swine fever, and we invite all participants that have joined us both via social networks and via Zoom to tell us and write in the chat what countries you're listening us.
Son un esfuerzo conjunto entre varias organizaciones nacionales e internacionales que trabajan a favor de la salud animal, la inocuidad de los alimentos y otros temas agropecuarios de interés hemisférico. Y bueno, a continuación vamos a iniciar con la inauguración del evento de este día de hoy, con unas palabras de apertura de nuestra directora de Sanidad Agropecuaria e Inocuidad de los Alimentos, Ana Marisa Cordero. Adelante.
Go ahead, Ana Marisa.
No, adelante.
Yes, go ahead.
Bueno, buenos días a todos, espero que se encuentren súper bien. Primero que todo, darles...
First of all, I would like to greet our participants and our speakers. A very warm welcome to this event when we will be doing an update on the response actions to ASF outbreaks in the Dominican Republic and Haiti. And this initiative is part of a number of webinars that is an important interagency effort that has been happening since last year. I would also like to welcome and thank not only the people who will be joining me in this event's inauguration, but also to our panelists, Dr. Angela Murillo, Dr. Haim Joseph, Dr. Jack Shear, and Dr. Abelardo de Gracia. Thank you for your effort and for your commitment for being here today and your effort for being here today. The idea is for all of us to share experiences and exchange information and ask questions about the different actions that have been implemented so far as a way to not only gain information, updated information on what is going on, but also information, and for this information to allow us to adopt measures at the local and regional level and among all of us to be able to deal with this disease, which is a major challenge that we're facing. I wish you all a lot of success, and I thank you all once again. Thank you. Thank you, Erika. Thank you very much, Ana Marisa. And to continue with our inauguration, I'm going to give a floor to Dr. Jack Shear so that he can give us some welcoming words or remarks. Go ahead, Doctor. The floor is yours.
Thank you, Erika. It's a pleasure to be here today, and thank you for the invitation. Looking forward to the seminar and listening to everybody and what they have to say. I'll try to impart some information about how the USDA and United States is looking at this disease and what we're trying to do to help the Dominican Republic and Haiti. Thank you, Erika.
Muchas gracias, Dr. Jack Shear, el cual es...
Thank you very much, Dr. Jack Shear, who is the administrator of the associate administrator of USDA APHIS. Now, we will give the floor to Dr. Abelardo de Gracia, who is the director of Animal Health at OIRSA. Hello, good morning, everybody. It is a great pleasure to be with all of you here today, sharing with all the different agencies this joint effort to be able to mitigate the consequences and the impact of a disease such as ASF in the American continent, and particularly in the Hispaniola Island. I hope, just like with all the other webinars that we have organized jointly with the agencies and the coordination of IICA, we will be able to continue finding the best ways to eradicate this virus in the Hispaniola and to prevent it from spreading to in other parts of the Americas. So may this be a very fruitful conference. Thank you. Thank you very much, Dr. Abelardo. So, as it was mentioned before, this training initiative is coordinated through a multi-agency alliance that is developed through GFTATS and IICA, together with this interagency group, to coordinate the capabilities regarding preparation against African swine fever for the Americas and the Caribbean. Let me remind you which are the agencies that are part of this: CaribVET, CAFSA, OIE, CAM, FAO, CDP, USDA, OIRSA, COPEG, and IICA. Today's seminar is going to be on an update on response actions to the ASF outbreak in the Hispaniola Island, as it was mentioned by Dr. Abelardo de Gracia. So today, we will have Dr. Ann Morillo with us, who is CVO from the Ministry of Agriculture of the Dominican Republic, Dr. Haim Joseph, the CVO from the Haitian Ministry.
El Dr. Jack Shear, como ya se presentó, es el administrador asociado de APHIS USDA.
Administrator of USDA APHIS, and Dr. Abelardo de Gracia, who is the Director for Animal Health at OIRSA. And for today's first presentation, we will be listening to the experience on the topic of the update and the actions with regards to ASF outbreak in the Dominican Republic, and this will be done by Dr. Murillo. I'm going to introduce Dr. Murillo. She is the Director of Animal Health of the General Director of Livestock currently, and she was up to 2022 of the Central Livestock Regional Director of the General Director of Livestock from 2001 to 2004. She's the Central Livestock Regional Epidemiologist. And then in 2021, she studied emerging and transboundary diseases. And in the same year, she also obtained a diploma on good animal health emergency management practices. And in 2009, she had the follow-up of classic swine fever, also in public health in 2002 as well, agriculture and livestock marketing, and then control and eradication of classic swine fever, and in 1995, an international course on animal production, and in 1992, an improvement of animal production. With this summary of her CV of Dr. Angela, I give her the floor. So, Doctor, we will be sharing the screen with you, or for you, and if you can turn on your
Así que muchas gracias.
Microphone and start speaking, and then we'll begin.
Sí, buenas tardes a todos y gracias. Gracias por la...
Good afternoon, everybody, and thank you all. Can you hear me? Yes, we can hear you, doctor. Okay, perfect. So we will be talking about the situation of African swine fever, the epidemiological situation from the very beginning. For us, the disease started even though it was notified on the 7th of 2021. That was the first one. So that's when we started doing the research. Then in the 22nd of the same month, we gave follow-up to different claims that or reports were sent. And then a sample was sent. And then we had confirmation of the diagnosis in Plum Island on July 27th. So for us, it started on June 24, 2021, because we had some samples that were sent to the US and they also gave a positive result for ASF. Can you turn to the next slide, please?
¿Puede pasar la próxima diapositiva?
Next one, please.
Ajá. La siguiente. Bueno, en ese
Very well. So, since we had already confirmed 11 provinces that had been affected, as you can see in the map, these were the first 11 cases that were found. Here, we can see the disease was of the cases that we had found. We have all these different lesions that we are still seeing. This is the clinical presentation of the disease. Next slide, please. I apologize, but the interpreter cannot hear the speaker. Yes, can you hear me now? Yes, we can now. Okay, please go ahead. Okay, so this is the origin of the epidemic. As I had mentioned before, the first confirmed case was on April 2021, because there were some rumors that some pigs were dying, so those samples were taken. And before that, we had been doing some work with the US lab, and we had sent some samples to see if this was the classic swine fever or what. So in the initial sequencing, the genotype was the one of Georgia 2007 and study of the virus. We think that the virus had been in the country from early 2021. Some possible routes for its introduction, or the hypothesis of the introduction route. Next slide, please.
Nosotros tenemos la hipótesis de la ruta de introducción de la enfermedad.
We have a hypothesis as to how the disease entered. We suspect it can be because there were some reports of pigs dying in Haiti and colleagues on the border. We might think it was proximity there. Another rumor or the rumors we heard was because there was a mistreatment of waste in cruise ships. There was also the possibility of illegal introduction or illegal entry of pork products by tourists. And before the outbreak, there had been already products found illegally from China, and they were seized. Next slide.
La situación actual que tenemos.
So the current situation to date, starting in July 25th, 2021 until the 22nd of April, 2022, the accumulated foci are 1,242, closed 1,005, reports recorded by animal health 1,035, and reports attended to 1,016. So there we see the map showing our current situation up to April 22nd. Next slide.
Bueno, acciones implementadas.
So the actions we've implemented. This started from the very beginning. The moment we found out about the disease, the Committee to Eradicate African Swine Fever was created. It includes several institutions. There was also the design and implementation of an emergency plan for ASF, as well as the implementation of a technique to diagnose ASF in the lab. Because at first, we did not have the capacity to process all the samples. So we've worked on that, and thankfully, and thanks to international organizations that have always supported us, we were able to improve that. And now current actions are first the agreement signed in Costa Rica this month with the USDA, DHEGA, and IICA. Then we also created an incident command center for African swine fever. It's in the process, but very much advanced. This is through coordination of the Ministry of Agriculture and our General Directorate on Livestock Farming. And we've also designed a strategy to control and eradicate ASF, still in process. This includes collaboration with DHEGA, APHIS, OIRSA, FAO, and other international organizations providing support. So those are the actions we have currently ongoing. Then, as well, in the beginning, we created brigades or specific task groups to investigate the cases and take samples. This was done nationwide in all our regional offices. Those are other measures we've taken. There's also been active surveillance and passive surveillance. And of course, we also attend to any reports. Here you see some pictures on the field of sample taking. On talks we give to our producers, and we also provide them informational brochures so that they can be educated. And here another picture on our lab work. Next slide. So mobilization, control, and quarantine. We're also working on that. There's a group in charge, strategic groups. From the very beginning, again, when we started seeing cases, this worked very well. We would now have to include this work or reinforce it in new control or checkpoints within our incident commands. That way we can ensure we can eradicate the disease. Next slide. This also shows some pictures of how we started. There was a lot of disinfection of streets and highways. There were some controls of vehicles coming through. This is part of the measures we took at the beginning of the disease. So, how are we eliminating positive foci? We have technical groups or task forces that are in charge of eliminating confirmed foci. So at the very beginning, we worked with the focus and perifocus, regions 10 kilometers away, some others 3 kilometers. And then it has changed over time as needed. The way we eliminate them is with the electrocution, slaughter through electrocution. We're trying to find other ways that might be a bit more efficient in culling. This is another series of photographs showing how once there's a confirmed focus of the disease, we prepare our brigades to ensure they dispose of the pigs that were positive with the disease. It's not the full process, but you see how we work with the pits. Once we have the pigs inside, the farms are disinfected and cleaned, and the pits are covered in lime. We also have a disinfection team. So they visit the places where we have slaughtered the animals, and they also go to the checkpoints, as you saw previous pictures, showing some highway checkpoints in certain areas. And we follow established guidelines to ensure cleanup and disinfection. Here we see some more of our crews disinfecting trucks on roadways, first cleaning and then disinfecting.
Otra de las acciones que nosotros tenemos en procesos.
Some more actions that are ongoing is the design and early implementation of forms to investigate cases and take samples through a digital platform. We are working on this currently to ensure that when we open the incident command center, once it's going and working, as it already has been opened, that we have another tool to help us provide better information throughout the process. Next slide. Thank you very much.
Muchas gracias, doctora Ángela.
Thank you very much, Dr. Angela, for your presentation.
Los inconvenientes de retraso en el paso de.
We apologize if there was just a delay with the slide switching. Before we start with our next panelist, I would like to hear from some of the audience where you're connected from. Go ahead and write in the chat box. I know that some of you have already done that, but just to encourage you to keep telling us what countries you're joining from, to be sure we can mention you. Thank you. And now we have the following speaker. We have Dr. Haim Joseph. She was having some problems with her connectivity. Let's just double check if we can hear her. And if we can, then the floor is yours, Doctor.
Sí. Hola.
I think you can hear me a bit better now. Okay, so let's go ahead and have your presentation. Thank you. So first, let me introduce you. Dr. Haim Joseph studied from 1999 to 2004 in the Agrarian University of La Habana, Cuba. She studied veterinary medicine and zootechnician. From 2006 to 2010, she was in the Haiti State University studying agriculture engineering and legal sciences. Starting in 2016 to 2018, she was director of the Department for Food Safety in the Ministry of Agriculture, Natural Resources, and Rural Development. She has also been deputy director of animal health nationwide, also in the Ministry of Agriculture, Natural Resources, and Rural Development. From 2004 to 2008, she was part of the support group to research the west part of her country, and she was a consultant to provide training to veterinary agents and technicians. From 2004 to 2007, she was head of the Service of Animal Quarantine. In 2007 to 2010, coordinator of programs of vaccination and epidemiological surveillance of poultry to control zoonosis and animal disease. From 2005 to 2010, she was coordinator of development in Haiti and a consultant providing training for surveillance technicians and veterinary technicians for small ruminants. In 2012, she worked as professor at the Episcopal University of Haiti. In 2015, she was part of the Superior Institute of Education of the Ministry of Public Health and Population. In 2017, she was professor at the University of the Caribbean in the School of Agriculture Engineering, working on animal pathology and physiology. From 2018 to date, she has coordinated the Unit for Protection of Health in the Ministry of Agriculture, Natural Resources, and Rural Development. I now give the floor to Dr. Joseph. Go ahead.
Madame Calderon pour sa présentation.
Buenos días a todos. Quiero agradecer a la doctora Calderón por haberme presentado y ahora voy a hablar sobre el estado de avance de las acciones implemented in the fight to eradicate African swine fever. Apologies. So we are now going to look at the state of progress of actions in Haiti regarding ASF. The first steps taken to fight the disease in Haiti are as follows. I will do my best to see if I can work with the slides myself. We also have a video. Should I go ahead and play the video? Let's try and do the video at the very end, please. Okay, thank you. So, just to give you some context, in Haiti, from the moment we detected African swine fever in Dominican Republic last year in July, and the communication by World Health Organization in Haiti, we started a series of actions to help us learn about the sanitary status of African swine fever, specifically in Haiti, and any actions taken. So the first thing was to immediately adopt certain measures. Once we heard that in Dominican Republic there was a confirmed case of the contamination of African swine fever. Just as a historic reminder, Haiti had the epidemic of African swine fever in 1979. Since that time, we managed to eradicate the disease, ASF, and then we also had the classic swine fever outbreak in 1996 and Teshon's disease around the 2000s. This is also known as encephalomyelitis. And this was between the 2000s and our current date. We had two large outbreaks of swine disease, which is the classical swine fever and Teshon's disease, which was first introduced in 2009. And in September 2021, we saw the resurgence of African swine fever. After the actions implemented to ensure early detection of ASF, once we heard this disease had been found in the Dominican Republic, so there was that early need to reinforce our actions in our country, considering epidemiological surveillance, and with already some other swine diseases in the country with Teshon's disease and classic swine fever. So that led to much efforts to ensure we could detect ASF as early as possible. We have traditional farms for swine rearing. This is the predominant nature in Haiti, although we do have some organized farms or industries with more modern production units. Swine production has about 800,000 animals overall, according to our latest statistics in 2018. Once we were notified, thanks to information reported from others, we transmitted this information to our important authorities, our minister and the prime minister, who initiated an interministerial commission for the health emergency. And there was also a resolution drafted to prohibit any trade exchange of live pork and pork subproducts from countries where ASF had been detected, including the Dominican Republic. The objectives of this commission are, of course, to have the early detection of any foci, to inform authorities on progress, and also producers, so they may be aware of actions. All this was also done to ensure we could identify, control, and manage the different foci of the disease, and to ensure we had information to help take other measures once the disease was detected. These actions include epidemiological surveillance, reinforcement of lab diagnosis, collecting samples and information, also providing information to all stakeholders, producers, providing technical support to traders, meat sellers, pork sellers, live pork and pork meat sellers. And again, samples were collected and sent for analysis to laboratories and institutions in the United States, as we had difficulties diagnosing the disease in our country. And because it is so easily spread, it has to be declared mandatorily. And so labs that we have do not have the capacities, unfortunately, to do such an early detection and diagnosis of classic swine fever, Tahitian disease, of African swine fever, though classic swine fever and Tahitian disease can be detected. After the work on diagnosis, providing again also awareness raising and communication, after the disease was detected in the southeast of our country, we had other cases in other areas of the country, more towards the north. And so we had to see how to continue our actions and detection. The spread of the virus, as well as our actions, wanted to ensure training and capacity building in veterinary technicians, producers, and others in the different departments of the country throughout structures that we had already under our Ministry of Agriculture. However, we still could not stop the virus from spreading in spite of all our actions. And currently, the virus is still being detected, and the contamination of the disease has spread almost throughout the country. We have a total of 420 positive cases and 2,500 samples. Yes, so here we see the samples collected, which is 1,560 animals. And there was a time when we had a slight decrease in all departments of the country. And here you see the latest chart showing September to February, with the virus present in 7 departments of the country. And from February to April, with the latest diagnosis and tests in labs in the US, we had first the 7 departments as mentioned, and then 10 departments in the country contaminated. The departments are how we are divided in the country, right? This is the geographic division in Haiti. So we have departments. So it went from 7 to 10. And so other actions were undertaken to ensure detection of the virus. Again, much work on communication and education, sharing information with the Ministry of Agriculture and other public and private institutions, such as technical agents, such as IICA, FAO, USDA, and APHIS, other partners, participating in regional webinars. And there was also an initial mission by the FAO to analyze the situation. We also had a visit in February by APHIS, and February and March, APHIS and USDA continued visits in the country. And we updated our action plan to combat African swine fever in Haiti. And the action plan was shared with all the institutes and offices in charge of animal health and rearing, and with different technical agents that work with Haiti and with Haiti and have worked with us since the 2000s to fight and control classic swine fever. So this is a tripartite technical mission, actually. It covers Haiti, USA, and the Dominican Republic. This is because we had asked for assistance, and it led to this alliance, the tripartite alliance between Dominican Republic, United States, and Haiti. This technical mission recently met in Costa Rica with participation of the IICA, where there was discussion on potential actions and interventions to undertake in Haiti and the whole island, supporting veterinary services under the Ministry of Agriculture. During that tripartite meeting, highlights are technical support to continue our ongoing testing of the virus, to record all producers, and ensure there's good communication of actions nationwide, as well as biosecurity actions in labs and pork production centers. Additional collaboration with the Dominican Republic also worked on buffer zones to ensure there was limited access of the virus to the countries or to exchange between the borders, and to avoid any animal crossings or other negative consequences. And currently, as I said, this action plan is being revised, and it will also have support from APHIS USDA so that we can ensure ongoing actions and support to combat the virus. We know it is a devastating disease, and it leads to large economic losses for producers. And it also leaves them without their livelihoods. As I said, this disease is easily spread. And it seems we have lost connection with the doctor. Doctor, are you there? Can you hear us? Can you hear us? We cannot hear you, doctor. I think we do have her, but with some problems. There she is, there she is.
Let's try. Doctor?
Qui montre le paquetage des échantillons, le traitement et le stockage et l'empaquetage.
Here we have the samples, how we send them to that laboratory. We must say that this is a lab for diseases such as swine fever. And we had to do a double check to confirm the test after the diagnosis that was carried out at the country or in country, in this case, Haiti. But due to the limitations that I mentioned at the beginning, we had to use the laboratory despite the costs to be able to carry out the diagnosis. So the first diagnosis of this virus, and up to date, we have been using this service. We tried to develop a space in our lab to continue doing this testing because we have the support of this laboratory, but we will need to have an active and functioning laboratory of our own to be able to declare the country free from African swine fever and be able to obtain that status. These actions were possible thanks to the support of IDB, the Public Treasury, APHIS USD, the Laboratory of Plum Island, IICA, and FAO. I want to thank you for your attention, and I hope you were able to understand what I wanted to tell you. I hope you were able to hear me okay, and I'm very sorry if there was any inconvenience, technical inconvenience. I hope I'll be able to answer your questions later on. And hopefully my internet connection will be available for us, for me to be able to take care of your questions. So thank you. So I would like to thank, I apologize, I would like to thank especially Dr. Joseph, because despite her complicated situation in Haiti, she did her best to log in today. We understand that you have some electricity problems and internet problems, so she has been more than willing to collaborate with us today. So, Doctor, we thank you deeply. I understand the effort you made to be here today, and all the information that you provided us was truly useful. Now, I would like to mention some of the countries that have logged in so far. Mexico, Colombia, Venezuela, Guatemala, Ecuador, Canada, Nicaragua, Trinidad and Tobago, Puerto Rico, Panama, Uruguay, Paraguay, El Salvador, Cuba, Bolivia, Peru, Chile, Honduras, Costa Rica, the Dominican Republic, Haiti, and Brazil. So, as you can see, we have a very good representation of the Americas and Caribbean. So let's move forward. Continue telling us where you're coming from. Somebody just wrote that she's logging in from Peru. So welcome all who logged in from the beginning, and welcome those who just joined us. Now we will continue with our activity. Then our next presentation will be by Dr. Jack Shear. He will be talking about the different actions that the USDA has been carrying out to collaborate with this outbreak in the Hispaniola Island. And let me introduce you to Dr. Jack Shear. He is the Assistant Administrator of Veterinary Services at the United States Department of Agriculture and APHIS, and the Animal Plant Health Inspection Service, APHIS. And beyond the domestic program disease work, which is a large part of the veterinary services mission, Dr. Shear has worked on animal disease outbreaks such as Salmonella enteritis, foot and mouth disease, and vesicular stomatitis in England, low pathogenic avian influenza, and exotic diseases. The Newcastle disease and highly pathogenic avian influenza during 2002 and 2003. He was in the outbreak of exotic Newcastle disease in California, Texas, New Mexico, and Utah. He served as Joint Area Commander and Incident Commander for the task force that eradicated this disease in the United States. Dr. Scheer has also held many positions since joining the USDA-APHIS Veterinary Services, serving as a field veterinary medical officer in Nebraska and Wisconsin. In Wisconsin, he worked both in the field and statewide, as he's been the epidemiology officer since 1991, or from 1991 to 1999. In 1991, he was promoted to the area veterinarian in charge, and in April 1999, or from April 1999 to November 2002, Dr. Scheer was promoted to the position of regional director for the west side of the associate regional director for the western region of the United States. From 2002 to 2013, he was the regional director of the eastern United States Veterinary Services. Dr. Scheer received a bachelor's degree in biology and chemistry in 1991, and he obtained his master's degree in 1987 in education with a concentration in counseling in 1988. From Iowa State University. He practiced clinical veterinary medicine for 3 years in Georgia. He received a joint PhD in poultry science and microbiology at the University of Wisconsin in Madison, Wisconsin. His doctoral research and dissertation involved the epidemiology and ecology of Escherichia coli 0157H7 in cattle. So with this information, we give the floor to Dr. Jack Scheer so he can make his presentation and he can share his screen too. Go ahead, Doctor.
Thank you, Erica. Hope this works. Can you see my slides? Is that working? No.
Todavía no ha compartido pantalla.
You're not sharing your screen yet.
It's not coming up.
Ahora sí la vemos. Ya la puede poner en modo presentación.
We can see it now. You can just do the presentation mode, please.
Okay. Is that better?
Perfecto.
Perfect.
Okay, great. Thank you very much for inviting me today.
Muchas gracias por invitarme el día de hoy. Se los agradezco.
I want to thank IICA especially.
Quisiera agradecer al IICA especialmente.
I'll be talking about
Vamos a hablar
that the United States is taking
sobre los diferentes pasos que ha adoptado Estados Unidos con respecto.
How do I shut off the interpretation? That's really confusing.
Voy a apagar la interpretación porque es muy confusa.
Por favor, la interpretación.
I'll just try to go on. So I'm going to talk about what the United States is doing in regards to ASF in Hispaniola and what we're doing domestically. So on the first slide, you can see that when I'm talking about what's at stake. And really what's at stake here is a devastating economic loss of the effect of African swine fever should it get into, for instance, to the United States in our swine industry. It would cost our industry billions of dollars in lost trade and production. It would have multiple economic impacts, both domestically, and some of these include there'd be a huge halt in the U.S. pork and pork products export. About 28% of the production in the United States is exported currently. Would be a huge impact on the decrease. It would cause a decrease in swine prices because of an increased inventory. Everything produced in the United States would stay in the United States because of the disease, which would be more than the U.S. consumption. There'd be widespread disruption in not only pork production, but all ancillary affected industries such as grain and feed, transport, and movement. There'd be huge employment losses because of the individuals that work in the industry would suddenly find themselves without a job. Preliminary estimates say that it could equal as much as $15 billion in losses to the pork industry based on a 2-year scenario. Most likely it would be, if it got into the United States, we'd be looking at more than a 2-year scenario with about $50 to $80 billion in losses, because we would, if we were unable to contain the spread of the disease, and we're looking more at a 10-year scenario, according to information that's been provided by the Iowa State University in a study they completed. The World Trade Organization has stated that ASF has wiped out more meat production than any other disease in modern history. This said, it shows that this disease has had a greater effect than any other disease, including the COVID-19 pandemic, which is small compared to what ASF has done. So going on, what would happen and what does the widespread of this virus look like? We know that it's spread quickly through Asia, and the mortality rate of this disease, as we know, is more than 100%, depending on the strain. We know there's no treatment, but we are getting closer. There is a vaccine being worked on in the country of Vietnam that has great promise, and it's a gene-deleted strain. We're looking forward to further research in safety and efficacy with that strain. Since January 2020, ASF has been reported in more than 35 countries with 1.8 million animals lost. Those losses are because of animals that are not only animals that get the disease, but animals that have to be culled around the disease to control the spread of the disease. The only way to stop this disease, as we all know, is to depopulate all affected and exposed animals that are in the swine herds themselves. So this is a very serious disease, and when it was found in the DR in Haiti, the United States wanted to take all necessary measures to help those two countries in dealing with the disease. So it's in line with our philosophy of the classical swine fever battle that's going on, and the ASF Cooperative Surveillance Program that started in the Western Hemisphere in 2019. After the 2019 Americas meeting, many of the Caribbean and Central American countries were quite concerned about their ability to test and find African swine fever. And as many of you know, African swine fever was spreading quite rapidly in Asia, starting in 2018. So we came back and we asked several countries if they'd be interested in lab cooperation to test for African swine fever. We already had a pretty good working relationship with the Dominican Republic's lab on avian influenza. So when they volunteered to send samples to the United States, to our lab, our foreign animal disease laboratory at Plum Island, that was a good fit. So we began testing in 2019 quarterly samples from the Dominican Republic. This, of course, went on until 2021, when in July, as many people have already stated, of 2021, we confirmed ASF in samples from hogs in the Dominican Republic near the Haitian border, first in just 2 provinces. That stimulated testing in Haiti as we began testing for them also, and we confirmed, as Dr. Joseph Haim has stated, in September of 2021, we confirmed African swine fever in Haiti. Since that time, APHIS, and almost from the beginning, APHIS tried to assist by sending our technical experts. First of all, we sent lab specialists to work in the laboratory in the Dominican Republic to get them and to work with their laboratory folks to get the PCR test in place and work to make sure that that testing could be done in the laboratory in the Dominican Republic. And we've been on the ground in the Dominican Republic almost since August, working with them on processes that we could help with. And I'll go more into that in just a minute. Almost immediately, Secretary Vilsack, our secretary, procured from the Office of Management budget about $500 million to use as emergency funding for both international and domestic efforts to control and eradicate ASF, both in the DR and Haiti, and also to prevent that introduction into the United States. The funding was targeted specifically for activities such as testing samples, including the costs of personnel detailed to the DR, supplies, transport of those samples, and equipment to get those samples. Outreach and communication, both in the United States, Puerto Rico, and the U.S. Virgin Islands about this disease and what it looks like and how to get testing done for this disease. Cost of removing feral swine from Puerto Rico and the U.S. Virgin Islands. There was, since the Hurricane Maria in 2018, many of the Vietnamese potbelly pigs that were pets in Puerto Rico escaped from some of their enclosures and set up a breeding population in Puerto Rico. Our Wildlife Services folks have since worked both in Puerto Rico and the U.S. Virgin Islands to eliminate the potbelly pigs in Puerto Rico along the coastal areas and to get rid of the wild pigs in the U.S. Virgin Islands, especially at the national parks. We've been doing domestic surveillance and testing in Puerto Rico. We've enhanced the inspections of travelers leaving Puerto Rico for the U.S. and the mainland. In the DR, we've offered technical assistance, laboratory support. We've worked with them on ICS and surveillance and putting together an indemnity package. The surveillance plan, we hope, will be implemented soon and that we can move forward across the island to find the disease, control the disease, and eradicate the disease. In Haiti, we've been working closely with them, as Dr. Joseph said, on testing of lab samples, and we intend to have and include them in technical meetings so that we can move forward with their plan that she outlined is in process to help them control and eradicate the disease in Haiti. We are evaluating the needs of both countries to further determine where we can assist and where we can fill the gaps, both from a standpoint of our technical expertise and our funding and support for resources. So what are we looking at for goals? We are working with our foreign agriculture services, our U.S. Embassy, and international partners, which are very important to help us with the donor part of this, IICA, OIRSA, FAO. We're also working with USAID and, of course, the agriculture ministries of both countries. We want to help both countries develop their programs to control and eradicate ASF from their countries, as well as prevent it from leaving Hispaniola and entering the United States, other Caribbean countries, South America, Central America, Mexico, or Canada. We want to diminish, eventually, and eliminate the disease from Haiti and the Dominican Republic. The way this has to be done is through control of movement and removal of infected swine. So as I stated before, when we diagnosed African swine fever in the DR, we moved swiftly to bring technicians in to help in the laboratory. We worked to set up a memorandum of understanding with the Dominican Republic to establish the framework for the eradication program that they wanted to put in place with specific work plans, specific budget, general planning, and direction. These work plans and budget are the coordination that is needed for both international, regional, and federal partners. So we're working with international organizations through these organizations to disperse funds. APHIS is coordinating through work plans with these international organizations, funding and purchasing. We're supporting the National Veterinary Laboratory, Lavisan, with supplies, equipment, and our detailed staff. We have contracts in place for lab capacity improvements such as IT capabilities, biosecurity, and laboratory expansion, the construction of which many of these are already underway. We want to develop, as we move forward, incident command structure, and we've gone through training, and the Dominican Republic has placed many of their folks into the incident command structure. We're assisting with that ICS-led response with guidance and information. We only plan or plan to support them in that ICS structure. We plan to support the lab, their surveillance plans, their depopulation, and of course their indemnification. We're establishing a formal indemnity process and finalizing those plans for implementation with the help of IICA. Our APHIS leadership is in country. We provide hands-on support, overseeing operations and ensuring that their program is effective and helping out wherever we can. We're sending experienced Spanish-speaking. We've set up an experienced Spanish-speaking co-incident commander to work with their incident commander, and we continue to deploy folks to the country until we get 6 foreign service positions filled, at which time that will make up our incident command structure to work with the Dominican with their permanent incident command structure. We have delivered trainings to the field veterinarians, to animal health technicians and producers in multiple cities to explain and outline what incident command is and how it should work. But the Dominican Republic will certainly establish their own incident command structure for what works for them. In Haiti, as Dr. Joseph has said, we have visited them on a couple of occasions to sit down and discuss their ASF plan. We have met with their lab staff to determine their laboratory capacity, and we are considering options of how we can assist. We are permanently hiring 2 foreign service officers to position them at the U.S. Embassy to assess and assist with the ASF situation in Haiti and identify opportunities for that potential assistance from us and other donor groups. We are working with Haiti to provide training to their laboratory personnel, which is under discussion whether that training would occur in Ames, Iowa, or the Dominican Republic in Santo Domingo at their Lavisan lab. There's been discussion of the trilateral that recently happened about 2 weeks ago. With the assistance of IICA, we held a 3-day trilateral with the Dominican Republic, Haiti, and the United States in Costa Rica. We focused on ASF response coordination, training, lab support, and surveillance, especially at the DR-Haiti border. This resulted in several next steps that were agreed upon. By April 29th, Haiti will share with the DR, US, and IICA a draft version of their work plan and their global plan for technical annexes, Annex 1 through 7. Annex 7 is the buffer zone, Annex 6, the communication plan, 5, surveillance, 4, outbreak closeout, compensation is 3, and indemnification. Annex 2 is sampling and biosecurity, and Annex 1 is production site biosecurity. The U.S. and Haiti will work together to evaluate the plan and develop areas of collaboration by May 10th. The DR and Haiti and the U.S. Chief Veterinary Officers are going to attend a 2-day workshop to discuss and align work plans between May 12th and May 16th. APHIS and Haitian officials will work to have a 5-day meeting on a memorandum and develop a memorandum of understanding. We're still working to determine when that date will occur. I believe probably a lot of that work will be done at the GERA meeting, which is coming up, I think, May 24th through 27th. We're going to follow up on those work plans and other issues at the Global Swine, at the GERA meeting on May 22nd through 26th. Excuse me, I got the wrong dates. The work plan implementation will begin as early as June 1st. APHIS, of course, is going to provide $50 million to IICA to manage compensation. That's in the DR. Some of the priorities that we have for both countries is to expand their lab capacity, develop and implement national level surveillance strategies, fully deploy the ICS structure, which is well on its way in the DR, develop and implement an indemnity program. APHIS has entered, as I said before, into an agreement with IICA to do this and is currently under internal review. This is to assist the strain on the DR's funding that has occurred because of this disease and the widespread damage it has caused. There's a binational coordination plan on ASF response between Haiti and the DR that's in process. We want to improve and work with the countries to improve their movement controls within the countries and outside of the country, and then to enhance their biosecurity and biocontainment is another very important direction that we're working on. Domestic activities in the United States, as I said, we're moving to remove feral swine and PR in the U.S. Virgin and Puerto Rico and the U.S. Virgin Islands. We are also monitoring all the domestic swine on both islands. We look for and do surveillance around illegal boat landings, and we have a response team for that, where surveillance is done around those landing areas. Garbage feeding and surveillance of slaughter swine is also ongoing. We have worked on enhanced communication about the potential of ASF and its impact to the U.S. territories and the mainland. We have done outreach to community and producer groups in both the PR and the U.S. Virgin Islands. We have programs in place to educate producers and owners on how to practice good biosecurity. We want to alert all the residents to report problems that they see with feral swine and discourage that they release these animals that were once their pets. We want to inform all travelers that they can't take certain things to the mainland. We have ongoing digital newspapers and ads aimed at travelers, producers in the U.S. and Puerto Rico and the U.S. Virgin Islands. We are launching a campaign aimed at international travelers to the U.S. and the mainland this month, as well as outreach to veterinarians across the United States. We are reviewing our strategy for reaching all producers and veterinarians across the entire mainland. We have a pre-departure program at ports and airports where we're working with the Customs and Border Protection organization in the United States. They are deploying additional canine teams that basically greet passengers when they get off the planes. They quietly smell their luggage and see if there's any pork or pork products contained within. We did establish an OIE protection zone. I think it's the first time it was used for Puerto Rico and the U.S. Virgin Islands. And that maintains current health status for the mainland of the U.S. should ASF be detected in either Puerto Rico or the U.S. Virgin Islands. We also have established safeguards against ASF, temporarily suspending movement of pork and pork products from the U.S. Virgin Islands and Puerto Rico. We revised our federal order, of course, to resume commercial movement of certain processed swine products after that. That was done in December of 2021. And movement of live swine and germplasm is still prohibited. Some of the challenges that we face with ASF in affected areas are pretty simple. If there's a long-term commitment, there has to be a multi-year program to attack this disease. We have to anticipate additional requests for support as more countries heighten their surveillance. I think the heightened surveillance is something we'll see in the near future. There is opportunity. There's a long-term benefit of the collaboration that I see going on between the DR and Haiti and the United States, as for not only for those three countries, but also for the international community. We want to prevent the spread of this deadly and costly virus. I want to thank you all for allowing me the chance to speak, and I'll close out there. Thank you, Erica.
Muchísimas gracias, Dr. Shear, por su excelente
presentación. Thank you very much, Dr. Shear. Excellent presentation. As we've heard from Dr. Shear, this is an effort coordinated by several regional and international organizations and institutions such as OIRSA, FAO, IICA, and other agencies. They've all provided help not just to the Hispaniola Island, but of course to ensure collaboration among all the region of Latin America and the Caribbean.
Con nuestra última presentación.
We now have our last presentation by Dr. Abelardo de Gracia.
También de las experiencias.
He will be sharing some actions taken by OIRSA in the Hispaniola Island. Dr. de Gracia studied epidemiology and risk assessment in Colorado State University in 2001. He's also studied epidemiology and economics to plan animal health programs in Germany, a master's in experimental and applied epidemiology in 1997, Sao Paulo University. He also is a veterinary doctor with the University of Sao Paulo. And in his professional activities, he has been a field veterinarian of the National Directorate for Health, for Animal Health from 82 to 87, also epidemiological assistant under the National Directorate of Animal Health of the Ministry for Rural Development and Agricultural Development from 87 to 90, head of serology of the National Laboratory for Diagnostics and Veterinary Investigation. And under the same ministry, 90 to 94, he's also been head of the Epidemiology Department of the National Directorate for Animal Health of the Ministry of Agricultural Development from 97 to 2000. He was representative of the International Regional Organization, or OIRSA, from 2001 to 2014, Regional Director for Animal Health in OIRSA from 2008 to 2014, Animal Health Officer with OIRSA and Regional Head of Cross-Border Diseases from 2015 to 2017, Regional Director of Animal Health in OIRSA from 2018 to date. He's also been a member of the GFTADS group of OIE-FAO for cross-border diseases in the Americas, and as a member of group of experts on African swine fever in the Americas, expert of the OIE to assess veterinary services, and currently coordinating the working group of the OIE for classic swine fever in the Americas. With that, I give you the floor.
Gracias, muy amable, Erika.
Thank you very much, Erica. Can you hear me? And can you see my presentation? Yes. Thank you. First, I will talk about the group organized to prevent African swine fever. And then I'll refer to how we've supported the contention and control of the disease in the DR. So we've started working in 2018 to date in the prevention of the disease in countries that are members of OIRSA and do not have the disease. We have 9: Mexico, Belize, Guatemala, Honduras, El Salvador, Nicaragua, Costa Rica, Panama, and the Dominican Republic. So it's 9 countries total. In October 2018, we started working on prevention. For that, we prepared general recommendations to prevent the disease from entering the countries. We had a virtual seminar on African swine fever in March 2019 with the support of the University of San Carlos, Guatemala, and the Professional Association of Veterinary Doctors. That same year, we provided support to countries, providing them with an ASF diagnostics kit so that they could do their testing. We also have a regional laboratory, IICA, in the School of Veterinary Medicine of University of San Carlos, which helps confirm diagnosis when necessary. Also in 2019, we worked on the situation of the disease for our countries and also how to prevent entry of the ASF virus. This is a sample of some of the material we've produced to ensure prevention. There are videos in Spanish and English. We have flyers and infographics and other information. We've also created an application, the OIRSA library. And there you can find a general manual for emergency management. And we have videos showing how to perform necropsis in pork and how to ensure good disposal of cadavers. Also manuals on cleaning and disinfecting, videos, and instructions on how to clean, disinfect, and dispose of cadavers. And we've also provided conferences and even cartoon style material summarizing the findings. We also have a way to, or instructions to create a pit to bury the cadavers. Here we see the different dates where we had courses on ASF provided for technicians and producers in member countries of OIRSA, looking at a larger likelihood of the disease entering the countries. We also performed a risk assessment study, a risk analysis, and in October 2019, along with the IICA support, USDA and APHIS, we were able to hold a regional simulation in Guatemala in the School of Veterinary Medicine, and we received technical support. The study, the risk assessment is shown here, and we see the work of OIRSA for the region, showing Dominican Republic as a country of risk for the introduction of the disease, as well as for Mexico and Panama. Unfortunately, the disease showed that Dominican Republic could be a way to have the virus enter. And unfortunately, it was true. We are currently performing risk assessment. Sorry to interrupt, Abelardo. I think these slides are not moving. Or, well, we see that you are being cut off. The audio is not really very clear. Maybe you can try shutting off your video. That will help with broadband. Okay, where should I continue? Okay, we are seeing the slide showing the list of courses. The risk assessment is what I'm seeing. No, we see the dates, what you did in August and June 2019, the list of courses. Okay, let me see.
En junio y agosto de 2019.
Sí, estás ahorita en la que...
Now we see one with picture in the university. Okay. It seems I have a bad connection. I'm sorry, I'm in Nicaragua right now. So I apologize for that. I don't have a good connection. I can't do much. It's what I have available. I'll try and see if I can continue. So you did hear the part on risk assessment. Yes, the audio we're following, all right, but these slides, if you have it in PDF, it might be easier. No, I don't. I apologize. Okay, let's see. So I'll refer to actions of OIRSA and Dominican Republic. We're not seeing that, but go ahead. Continue because we can follow what you're saying. Okay, so I'll refer to actions. What we've done in the DR, what I first presented was all countries in OIRSA had been doing in terms of preventing the disease in our countries. And now let's look at specific actions that OIRSA has undertaken in terms of ASF in the Dominican Republic. I'm not mentioning Haiti because Haiti is not a member of our organization to date. So from the beginning of the outbreak, we sent our own technicians immediately. First, Dr. Carlos Moreno. 3 days after the outbreak was declared, I also joined the mission. And we had a joint mission between IICA, OIRSA, FAO, OIE to do the necessary assessments. Before that, in the DR, we had worked with emergency operations centers on an emergency response center. They did not have an updated plan at the time, so we worked together with other agencies, helping the DR in the preparation of that emergency plan to address the outbreak. If you see the picture on screen, we have the picture of the mission, the interagency mission members. We have another option, Abelardo. We'll have Marcela switch slides, so you can just go ahead, stop sharing screen to ensure you have better internet and hear you better. Thank you, that's helpful. Let me just see how I stop sharing.
Solo que me habiliten la función de compartir pantalla.
Ok. Pero esto ya, yo no la estoy compartiendo ya.
Doctora Abelardo, usted deje de compartir pantalla.
If you would stop sharing your screen, doctor, then I can do it. That's it, right? Yes, thank you. Okay. Okay, so Marcela can share the screen now. I apologize, sorry for that. It's not up to me, sorry, it's the connection. Don't worry. Okay, so there we are. Actions taken by OIRSA, you can see that, right? Yes, we do. Thank you. Good. So just repeat a bit here, I apologize, but to ensure we have it clearly. But the epidemiological situation is not something I will mention because we've heard by a more updated version already. So this is specifically on screen now, how we worked to ensure contention of the outbreak within 48 hours. OIRSA was supporting the DR already. There was a designation of emergency funding, $248,345 for phase 1. And then an additional fund of $551,000 for the DR and $493,226 for countries free of the disease to ensure we could still work on prevention. In total, it was $1,052,000, if I'm not mistaken, for phase 2 and almost $250,000 in the first phase. And so these are the funds that are currently being executed. There was also a committee created to eradicate the ASF. We supported the creation of the committee. And when joint work with APHIS started, we helped organize the incident command that is now being led, that is now leading actions in the DR. We also supported the implementation of diagnosis techniques for ASF in the laboratory LABESEN. That's RT-PCR and the ELISA antibody. And APHIS provided their support, as we heard already from Dr. Shear. And now we are executing
algunas reformas que están necesitando el laboratorio.
Some reforms in the lab with the APHIS funding in terms of biosecurity, new wiring to ensure we have fiber optics connection in real time. That's internally and externally of the LABESEN lab. So that's all being executed currently, and we hope to have this first phase completed by next month. That will ensure greater efficiency in diagnosis.
Marce?
Sí, ahí está ya en
Yes, we see it on screen. So what else have we been doing? Parallel to what I've already mentioned, we also established an epidemiological surveillance platform with the Ministry of Agriculture under the program called Seed Agro. We've already implemented epidemiology laboratory, preservation brigades, all the information on landfills and others. And we have some pictures there of how you would see the platform once you enter. And so we helped develop this platform with the Ministry of Agriculture and the IICA. There's also been work on dissemination materials, flyers, videos, posters, material for the DR and countries that are free from the disease. We've also worked in collaboration with different agencies like OIE, FAO, IICA, USDA, APHIS, for the part on education with OIE, with FAO. We've worked on biosecurity, and with USDA APHIS, we work very closely. I'll give some details soon. We've already developed 3 working plans that will be executed in the next 3 years through the incident command and with active and passive surveillance, improving communication systems, mobile apps for communication. There's also material to help manage cadavers with ASF. We have a cartoon video showing how to dispose of cadavers quickly and easily with specific measures to protect the environment as well. And we've provided talks in that sense. We've also provided informational regional sessions on the current health situation in the DR with all countries in the region so that they may be informed of the situation as it unfolds. And there's transparency of the DR to the other countries. We also have meetings, the technical commission, as we call them, with all the animal health directors of the region, and we discuss the situation of ASF. We've also updated all the components to ensure a good response in the event of a health crisis. We see the next one already. I think it's delayed for you. Yes, sorry. And what we see now on screen is first the MOU. We have 3 action plans with USDA APHIS. Apologies. We heard the interpretation. Yes, sorry. Thank you. So we have the MOU and 3 action plans. We've signed these agreements with APHIS. These cover the next 3 years in different areas. That's laboratories, quarantine, and prevention. We will train 37 canine binomes, 27 with funds from USDA APHIS and the rest by funds with OIRSA. The first group of 10 canine binomes for the DR starts on May 29th, and that's training for 6 weeks in the Canine School of Mexico. These 10 binomes will support, along with the next 27 with the funds of USDA APHIS, to help with all the luggage leaving the DR. So this is new in that sense. It's not only going to be for anything entering the DR, but for all flights leaving the DR to the United States and countries that are members of OIRSA to ensure we can prevent any potential escape of the virus in products or byproducts that are of pork origin taken by tourists or others flying to our countries. So that's a big novelty, if you allow me to say. So we will be inspecting incoming and outgoing. And this is being done jointly. The other part related to the agreements between USDA and APHIS and all the epidemiological surveillance and incident command. And the third aspect that I've already mentioned, which is support, financial support by APHIS managed by OIRSA to ensure we have adaptations and modifications in the lab for restrooms, showers, and the fiber optics and other materials needed in the lab. OIRSA will provide funding to finance the modernization of the computer side, wiring in the DHEGA, which is the General Directorate for Animal Health, for livestock farming, under animal health. In the map, you can see a proposal that we've worked on at OIRSA to see how we can support the traceability program and readjust internal mobilization controls. This proposal will be discussed with the DR authorities. They have divided their country already in 5 areas. We are suggesting the modification of certain checkpoints to control this mobilization. The map shows a line over meridian 7130 to establish the buffer zone, which could be created between in the DR close to the border with Haiti. So we could have another similar one on the Haiti side. And so this buffer zone would be under permanent surveillance. This again is just a proposal. We have to discuss with DR authorities and the USDA APHIS according to our plans. Next slide.
Ahí está.
There you go. I just have to wait a little while, sorry. It's delayed for me. Thank you. With this last one, if we could scroll up, I don't see a full screen. Thank you. So these are the necessary measures that we have suggested. There's 3 specific areas of work: quarantine services, the productive sector, and veterinary services. We are already working on some of these measures with USDA APHIS. And for quarantine service, we suggest strengthening the first line of defense in ports, airports, and land borders through intrusive and non-intrusive inspections. That includes canine units, scanners with image interpretation. And I include that part of interpretation because many places may have scanners, but they do not have specific software to truly interpret images to look for biological or food products. So the software should be included in all scanners that don't have it to truly ensure that we can find the presence of any food products in luggage. And also treatment of international garbage and waste. We have already prepared a diagnostic assessment about 5 weeks ago on all ports and airports at the DR, and we've seen the need to provide better treatment of international garbage and waste. So as I said, we've completed the study. We expect to be discussing this in further detail with DR authorities soon. As for the productive sector, to summarize, we have to work on first strengthening biosecurity in farms. The FAO has already done a study in terms of biosecurity. There's very few farms that are really technified, if you will, in the DR and that have that good level of biosecurity. So there's already a proposal there led by this agency to ensure we can improve biosecurity in the farms. We also need a better pork traceability system, and we need updated national census. The data we have are not updated. We need to improve that information. Also, enhancing controls for internal mobilization of products and subproducts throughout the country, having a greater public-private alliance and greater efforts to join both sides to ensure we eradicate the disease. There's also need for an awareness campaign and educational campaign for the general public and the media. And the media need to also be aware how to convey this information. And there has to be a revision of local regulations to ensure that they are now modernized. And as for veterinary services, the proposal to update national emergency plans and early warning plans to provide training and capacity building in response teams. This is already underway thanks to the work led by USDA APHIS with the incident command system. And again, enhancement in laboratories to ensure we can better test for ASF. Thankfully, this is already very much advanced. The DR now has the capacity to do the tests themselves, and they're already doing it. There's a need to have improved protocols for surveillance and for humanitarian culling, sending and collecting and sending samples, as well as disposal of cadavers and cleaning and disinfection. So that was it on my part. This is just to close now. And I truly apologize for my connection problems, but I am here open and ready for any questions, even in the difficulties we have. Thank you very much.
No hay problema, Abelardo, más bien agradecerte.
No problem. I just want to thank you, in fact, for logging in from the place that is having a drill right now, but we know that we can solve all technical problems. That's not a problem. I would like to thank all panelists today for your efforts, for your excellent presentations. And before moving on to the Q&A session, I would like to say that Colombia, Ecuador, Peru, Mexico, Guatemala, Guadalupe, Brazil, Canada, Nicaragua, Trinidad and Tobago, Curacao, Haiti, the Dominican Republic, St. Lucia, Jamaica, United States, Paraguay, Honduras, and Uruguay have reported their presence today. So thank you to all of you who have joined us during the webinar and this series of webinars organized by all of our agencies and this group of interagency work. So we're going to move on to the questions. We have a whole team formed by IICA and OIE who are collecting the questions and filtering them. So we're going to start with the questions for Haiti because we want to seize the opportunity that she's connected right now. She didn't have an internet connection for a long while, and she was able to reconnect again for the Q&A. So we're going to ask her the questions. So the questions for Dr. Joseph. Doctor, first question here. How did the virus get into Haiti? Can you give us some feedback on how you think it went into your country? Thank you. Go ahead. Dr. Joseph, can you hear me? Well, if not, we can just continue with the next question and wait for her to reconnect. Oh, go ahead, doctor. I was not able to hear well. The internet is not helping. So let me repeat the question. The question is, how do you think Haiti got the virus? Where did it come in from? So as I was saying in the message, in case I was able to connect, I said that first we would have to see how it was introduced in the region, because to come to the region, oh, French, sorry. So I'm going to speak in French. So for the epidemic to enter the region, there was a pathway that would be trade, tourists. Those are the possible routes through which the disease was able to be introduced from one country to the other. The region was virus-free, and we started seeing some cases later on. So I believe it would be interesting to see how the virus of the ASF was introduced in the region. For the case of Haiti, I would say that the first cases were found close to the border, as I said before, in the southeast of the country. And 1 or 2 months later, a few cases were diagnosed in the northern and eastern part of the country, and also departments close to the border and other departments close to the border again. So this was in the months of January and February. And the spread of ASF was related to these regions that were close to the border. So, since both countries are so close together, we may think or it was observed that there are common traditions and practices between both countries. Sometimes the animals are raised in one side of the border and then transferred to the other side of the border. So these animals are circulating back and forth in the border, and that is important to be said. And because of the evolution of the disease between the swines in the region, we may think that the first foci were due to exchanges of animals on both sides of the border, and that's how the disease went from one country to the other. Now, there are 2 strains. We have been able to find 2 different strains of the virus. One, the one diagnosed in the Dominican Republic in January, that was found in the northern part of Haiti. And another virus with a different strain that was found in China or in Asian countries. So we know that there are 2 strains of the virus. Thank you very much, doctor. There is another question here that reads, have you done the sequencing of ASF, of the ASF that is affecting Haiti? Yes, we've done this sequencing. It's been done at a lab in Haiti. That's why we can say and assure that this virus is of X or Y strain. We have not differentiated between the two strains. Now, there's another question that is for both countries, Haiti and the Dominican Republic. Have you lowered the number of new outbreaks to date? And at what point of the epidemiological curve are we? May I answer first? Yes, please. Well, regarding Haiti, there are new cases. And as I said in my presentation, the last gathering of information up to January, we had a set of 34 foci. And then we went from 34 to 63 foci with 401 cases in 4 departments. So from 4, we went to 7 departments, and now we can say that the entire country is contaminated with ASF. So that would be the current epidemiological scene we have right now. We are in the phase of mass detection, and sometimes this helps to control the disease. But so right now we have not been able to close the foci because of the difficulty we have in terms of compensation. That's the most complicated point and the most important point of the support that we will be given. Within the framework of the technical support, after we sign the Memorandum of Understanding, after the last version or draft of this memorandum and the annexes, we will be getting this financial support. Thank you very much, Dr. Joseph. I don't know if we have an answer from the Dominican Republic. Let me repeat the question. Have you been able to lower the number of new outbreaks, and at what point of the epidemiological curve are we? Go ahead, Dr. Angela. Dr. Murillo. I don't see her logged in. Maybe she lost her connection and we didn't realize until now. Well, let's move forward with the questions. Well, if any questions are left unanswered, we will make sure to send it to Dr. Angela so that she can answer your questions. And then we will be sending all of you. Please make sure to add your contact information so we can make a group list for you to receive the answer to the unanswered questions. So we have a few questions for the US, for Dr. Shear. Question: what is the specific distance to define a perifoci and the foci for ASF?
I think in the United States, what we're trying to work with is different zones. Infected zone would be about 3 kilometers, and anything in that circle would be restricted for movement. And then outside of that, probably anywhere from 5 to 7 kilometers for a surveillance zone. And this is a smaller zone than what we see for avian influenza because this disease is not as easily spread. It doesn't move as easily as avian influenza. So that's kind of what we're working with. And we try to follow OIE standards. Thank you.
Me aclaran por acá que la pregunta
I was just received the clarification with regard to the question that was sent to the DR and Haiti. They were able to lower the outbreaks and at what point of the epidemiological curve we are can also be answered if needed by the states or OIRSA. So if OIRSA or the US have an answer to that question, you can share your knowledge. Thank you.
I'm not sure that I can answer for the DR or Haiti. I do know that they're still working on their surveillance and the extent of the disease, as Dr. Joseph said, and I think Dr. Morea said also that it's pretty widespread in both countries, in all of their departments in Haiti and all of their, I think, except for one in Haiti and all of their provinces, except for, I think, 2 in the Dominican Republic. So it's pretty widespread. We've got a lot of surveillance and testing to do to remove the disease. That's our challenge, to get that surveillance plan put in place, find the disease, control it, eradicate it, and save the pigs that are not infected, create a protection area for them. Thanks.
Yo estoy de acuerdo con lo que dice Jack.
I agree with what Jack is saying. I think that we cannot answer that question yet. It's not easily answered. We still need to wait some time to see at what point of the curve we are. I still think that the virus is spreading, but we are working to try to improve the situation. So I agree with what Jack said. Greetings. So thank you very much, Dr. Shear and Dr. Abelardo, for telling us what they think. Let me tell you that most of the questions are aimed to the DR. There are a number of general questions that may be answered by any of the presenters. We were asked, are there any other animal species that can actually act as vectors and transmit this disease? Can it be transmitted by water? And the products like pork rinds and things in vacuum can still have active virus? These questions were some of the questions sent. So if any of the experts would like to take on to answer them, please feel free to do so.
I don't know. Jack, you want to answer?
I couldn't hear you. Abelardo?
No me escuchó. I know if you prefer to answer.
I can start and then maybe you can clean up my mess, okay? I'll say that animals,
okay,
other than pigs, don't transmit this disease. It can be transmitted though in what's called from a fomite standpoint. That's people, machinery, manure, any of the excretions of the pigs when they're infected can move this disease. It's not really airborne, so we don't worry about that. But cleaning and disinfection is important because it's maintained for a long time in the environment. It's a very healthy virus, very sturdy virus, doesn't dry out easily. Disinfectant has to be utilized. So those kinds of things are really important, but we don't worry about like cows spreading it, but a cow that stepped in pig manure and then went into another pig could spread it that way, but they don't carry the virus, so to speak. They don't produce virus when they get infected either. It's just pigs and wild pigs. I think that was the biggest part of the question. I can't remember the rest of it. Oh, products. How long does it live? Pork rinds. Depending on how they're treated, if things are cooked, it to a high degree of temperature, it kills the virus. So it's not generally in like pork rinds, but meat products that are not further processed or smoked, the virus can live for quite a long time, especially if refrigerated in those products. I'll stop there. Abelardo, do you want to add to that?
Sí, claro. Bueno, sí, lo que
yes, what Jack said is all true. We need to remember that there are no boars in the island, so we don't have a problem of a wild species here. But the problem of the products is true. High temperatures may kill the virus, but there are many products that are only cured, like sausages. And remember that depending on the time they are processed, the virus may survive. And some of the sausages that people buy do not comply with all the adequate processes regarding temperature. Some are homemade, and so I wouldn't be able to have a way to make sure that the product complies with all the processes. So we just need to be careful with that. And regarding the first barrier of the defense is to cease any swine-based product, because as Jack was saying, sometimes high temperatures for a long while may kill the virus or inactivate it, but we don't know if they have all undergone that process. So I wouldn't take any chances, any risks of allowing the entry of any of these products. And mainly because many of them are homemade and they don't have all the controls that they normally should have, that would not allow for it to transmit the disease. Now, regarding ticks have not been demonstrated to transmit in our continent, or at least in the Dominican Republic, may be involved. What Jack mentioned are the sources that we are mostly concerned about for the transmission of the disease of the virus, which are the ones that we need to be aware of. And as Jack said, if we start doing a good mobilization control and traceability of the location of the animals, we will be able to support these efforts and have some areas under control, and maybe some areas, and that's one of the proposals that we would like to discuss, and maybe we can do this in the next weeks when we will be meeting, and maybe we can discuss some of the ideas that we have, or that some of us have, on how to define a number of areas that may be more intense, that need to be isolated, and other zones that have a lower incidence of the disease. Maybe we can start thinking about applying a number of eradication measures there. But, oh well, that is something that's still on the table, and we will have to sit and talk about that. So I don't know if that supplements what Jack mentioned already. Thank you. Yes, Abelardo, thank you very much to both of you for your clear answers. We usually have this kind of general questions, these type of webinars, and this is the right place for these answers, or for these questions to be asked. The idea is for people to ask the questions they may have on ASF. I was told that Dr. Morillo is connected, but she has some audio problems. So we're going to do what we said we were going to do before. We will gather all the questions for her and we'll send them to her, and then she can answer your questions, and we'll send you her answers. So I would like to thank all presenters, Dr. Shear, Dr. Host Joseph, Dr. Murillo, and Dr. De Garcia for your presentations, for your explanations that were so clear. This has been a very transparent process. We have had lots and lots of communication between the countries and the international and regional agencies. So we would like to highlight that this has been a comprehensive, integrated kind of job in this fight for the eradication of ASF in the Hispaniola Island and the prevention of this disease in the rest of the Americas and the Caribbean. Thank you for all of those who have logged in, all the countries that have been faithfully connecting throughout this webinar and the series of webinars that we have held. And I would also like to remind you that these webinars are recorded via social media in Facebook and YouTube in each channels. And I would like to let you know that every month we have a new webinar. The next webinar will be held in May. And we will be talking about legislation and the actions covered by legislations with regards to ASF. And we'll have great presenters and they will tell us their experiences, because aside from giving you some teachings, we want you to share with your experiences by real people, real cases. And so with that, we would like to finish this webinar. I would like to thank all the countries that are involved in the organization of these webinars and make these webinars possible. So thank you all. Greetings to all. Have a wonderful end of the week and see you in the next webinar. Bye-bye. Greetings. Bye-bye. Thank you. Bye. It was a pleasure.